Prevalence and incidence are two different types of measurements that are used in the fields of public health and epidemiology to answer research questions related to certain diseases or health conditions in a population. According to Nephron clinical practice, prevalence represents the existing cases of a disease, while the incidence reflects the number of new cases of disease within a certain period. Epidemiology 101 explains that prevalence refers to the number of existing cases of a disease or health condition, or deaths in a population at some designated time, divided by the number of persons in that population. This measurement is used to describe the scope or amount of a disease, also referred to as the burden of disease in a population. Incidence, on the other hand, refers to the number of new cases of diseases or health conditions in a population at a certain period. Imagine you have been assigned to investigate a recent outbreak of a new disease in a town where every person in the population goes to one hospital for treatment and care. This is the only hospital for many miles, and the managers want to be sure they have enough beds and healthcare workers to treat the patients that are starting to pour in during this outbreak. This box portrays the aerial view of the hospital. Each time a new patient enters the hospital with this disease, they are taken to the care wing, which is highlighted in yellow. The care wing has been designated as the spot to keep patients for this specific disease. Each time one of the patients recovers, they leave this box and go back home. Each time one of the patients dies, they leave this box and they are transported to the morgue. This leaves the care wing only filled with people who still need care while suffering from this specific disease. The care wing is a representation of the prevalence, whereas each new patient entering the care wing is a representation of the incidence. Imagine the end of a pandemic when a steady number of patients leave the care wing through either recovery or death, and the incidence rate continues to drop. This would be a situation where there would likely be enough beds and healthcare workers available to help the remaining patients in this outbreak. The prevalence, in this case, would drop as well, since people are leaving the care wing at a steady pace while fewer patients are being admitted. If, however, patients are remaining sick for a longer period and consequently remaining in the care wing, while the incidence rate drastically increases as patients begin to pour into the care wing, then we can imagine that there may eventually be an issue with the hospital not having enough beds or healthcare workers to help the patients. This would be a situation where the prevalence is high and the incidence is high. As you can see, prevalence and incidence are helpful measurements to be aware of when determining a course of action for this hospital in their mission to provide quality care to their patients during an outbreak. I hope I have helped provide some clarity on what each of these measurements refers to and how they are different. May you be well.